Hello, doctor and medical students. I am Dr. Amit. So today we'll move forward in our cephalosporin discussion, and today we'll try to cover third generation, fourth generation, fifth generations cephalosporin. So let's talk about third generation cephalosporin. So third generation cephalosporin include ceftriaxone, then cefixime, cefodoxime, and ceftazidime. These are the drugs falls in third generation cephalosporin. These drugs have very strong gram-negative coverage and are resistant to many beta-lactamase. And a very major advantage of third-generation cephalosporin is that this group of drug can cross blood-brain barrier. So let's talk about its clinical use. We can use it in meningitis, okay, and then gonorrhea, after then severe gram-negative infections, and we can also it in disseminated Lyme disease. So now let's focus some important point of ceftriaxone and ceftazidime. So ceftriaxone is commonly used for meningitis, then gonorrhea and disseminated Lyme disease. And while ceftazidime is excellent and we can say that very good activity against Pseudomonas aeruginosa. Now, it's a very high point that ceftriaxone can cause biliary sludging. So we should avoid this drug against neonates. Now let's talk about fourth generation cephalosporin. So fourth generation cephalosporin include a drug called cefepime. Okay, and cefepime has a very broad coverage. It works mainly against gram-negative organisms. Then we can use it against Pseudomonas and many gram-positive organisms. Now let's talk about its clinical use. So we can use it against hospital-acquired infections, then severe neutropenia, after then or we can also say febrile neutropenia and severe nosocomial infections. So as compared to earlier generations, cefepime is more resistant to the beta-lactamase enzyme produced by the some bacteria. And now let's talk about fifth generation cephalosporin. It includes a drug called cefataroline, and cefataroline has a broad gram-positive and gram-negative coverage, and it has some important features like unlike first to fourth generation, first, second, third, and fourth generations, cefataroline can cover MRSA and Enterococcus faecalis. And but these cefataroline groups of drug do not cover the Pseudomonas species. Now let's talk quickly about the adverse effect of cephalosporins. So the adverse effect include hypersensitivity reactions like rash, fever, anaphylaxis, then autoimmune hemolytic anemia. After then disulfiram-like reactions, then vitamin K deficiency, which can lead to bleeding tendency in the patient. Then nephrotoxicity, as it increases the side effect of aminoglycosides if given together. And then Clostridoid difficile infections. It may cause pseudomembranous colitis in the patient. While talking about the resistance part, it can develop resistance against cephalosporin if the bacteria can produce cephalosporinase or structure alteration in penicillin binding protein.